Network. And there we go. We're getting started. Things are real. Awesome. I could not be more excited today to also share with you that this is a generative conversation. We really want you to be engaging with us and using the Q&A function below at the bottom of your Zoom screen. So please do submit questions throughout the entirety of today as you hear from Jess, Leslie, and others who are here from our team. I also just want to have you encourage you to use the chat function. So again, we want to really leverage the chat function today as we go along. And if you could get started with chiming in with your name, organization, title, anything you'd like to share with us about your identity. And we're asking today that you pop the question in there, answer the question today of what inspired you to come to today's conversation with Birth Center Equity, and maybe what are some of those questions that you have for us. So please do put a quick little intro in the chat so we can build some community there. And again, a reminder, we'll be using the Q&A function that's also down on the bottom of your Zoom screen for questions. And again, thank you so much for spending this hour with us. I hope that you're going to find it really inspiring and useful to the work that you do in the world. So with that, I will pass it off to my colleague, Jess, for them to share a little bit and call us into this moment together. Jess?
Alyssa. Hello, good morning, good afternoon. Maybe even there are some folks where it is good evening where you are. My name is Jess Goodfriend, and I'm the Senior Director of Resource Stewardship and Solidarity here at BCE. I use they, them pronouns. I'm also a midwife, and I'm joining you all today from the beautiful mountains of northern New Mexico. I want to start out by just thanking you all for joining us and taking the time and attention to be sharing this space with us today. I'd love, as you know, we're still welcoming folks into the room, for us to just start out by taking a breath, just a short beat to come into this big virtual circle together from all of the places and the lands that we are seated in today. So go ahead and take that breath. Um, so I'm going to make the assumption here today that all of us and landscape changes that have and will continue to change our lives, the lives of our community members, and the lives of future generations. I want to start us off with a quote today by Norma Wong, Buddhist teacher and movement leader, who some of us may know very well. Her quote is, "The opportunity before us is not because things are coming together, but because they are falling apart." We are at a moment where everything feels like it is shape-shifting in ways and at a speed we cannot fully comprehend. And it is both a danger and an opportunity at the same time. BCE was founded on the idea that a radical reimagining of the current distribution of capital and the resourcing of Black, Indigenous, and people of color communities to grow and sustain their own midwives, that we could alter the patterns of harm that are affecting birthing people across our country and reestablish networks of community care. I'm so excited for you all to hear from our co-founder and CEO, Leslie, what she has to share with you all today about the ways that Birth Center Equity has approached this work of redistributing capital and the model that has emerged over the last 5 years of shared learning that we have done alongside and with our network birth centers. In spring 2024, we launched this invitation to grow birth centers, and by doing so, to grow community through the raising of $10 million. We've traveled to Chicago, to Oakland, to New York, and have been accompanied by many valued partners in the work of raising this critical capital over the last year. And we've received an incredible response to the invitation. Now, as we meet you here today, a little bit more than a year later, and under a much more difficult landscape conditions than when we started, we are nearing our goal. BCE needs 1.5 million more dollars to be committed to reach our goal of 10 million for midwives, birth centers, parents, babies, and community. We're excited to invite you today to join us in helping us to complete the Grow Birth Centers Grow Community campaign, and by doing so, become a part of the opportunity to come together as we witness many things come apart. I now have the pleasure of introducing my colleagues, both Leslie and Kimberly, who you will hear from. Leslie Welch, as many of you may already know, is a public health strategist, a social entrepreneur, and a professional dreamer who is guided by the value of love. She's a co-founder of Birth Detroit, a freestanding birth center, Detroit, Michigan, and co-founder and CEO of Birth Center Equity. Kimberly Durden is a licensed midwife, a CPM, and an IBCLC. She is the co-owner and co-founder of Kindred Space LA, a Black-owned freestanding birth center in Los Angeles, California, and a member of the BCE network. Kimberly is BCE's director of midwifery network engagement. I'll pass it over to you all.
Good morning and good afternoon, and thank you for being with us today. And thank you, Jess, for the beautiful introduction. I hope that everybody can see my slides at this time. And I'm going to get us started, and then I'll be passing to Kimberly in the middle, and she'll pass back to me. So here we go. I wanted us to begin with a little bit of a celebration. I know that we have folks on the call with us today who are old friends and have supported us from the beginning. And we have a few folks who are new friends and plan to support us as we move into the future. And so I thought this would be a good way to give an overview of who we are and where we've been. And we celebrated 5 years this spring of BCE. We were co-founded in April 2020. Nashira Burrell and I founded BCE. BCE actually kicked off with the article that you see here. Birth centers are crucial for communities of color, especially in pandemic. At that time, we were inspired by, I call my friend Julie our founding volunteer, to write about the challenges that we were facing opening our birth centers in Detroit and in Boston. And the pandemic acted as a portal. All of a sudden, people understood that it was important to have a place to have babies where sick people were not. And we, really centered in on the fact that those folks in communities of color, those folks who look like us, were least likely to have another option to have their babies outside of a hospital in the pandemic. And so at that time, we asked our association, can you give us a list of the birth centers out there led by Black, Indigenous, and people of color? And we got only a few names. We had to build the network list with our elder Black and Indigenous midwives contributing to letting us know who was out there and snowballing who we got in touch with. And we're grateful to them to this day. And we had our first Zoom call as a network. You'll see one of our photos there where we brought folks together. We started BCE with the intention that we were going to help folks of color overcome the capital barriers to opening our birth centers and keeping them open. After that first Zoom call, we understood that our community had so many more needs, including the need to be in community with one another. We are a relationship and values-based network, including the need for capital, but also the need for other leadership development, business supports. And so we had our first grant making was rapid response grants in the pandemic. We had our first funder we were grateful to, and we were able to, at that time, divide up the money amongst ourselves, our small network, to fund projects like childbirth education, like rent for some of our birth center leaders, like Kimberly Durden, who you'll hear from. Or we even had one birth center midwives who did a home birth in a homeless shelter with those rapid response funds. We had next our Open Doors Initiative. Our Open Doors Initiative was created to help folks with a milestone to getting their birth centers open or keeping their doors open. The picture I'm showing you here is of Ashley Green in Texas, who built her birth center on her own property and got one of our Open Doors Initiative grants. You'll see her in front of her birth center. And then to the right of that, you'll see a picture of her birth suite. Her birth center is now open. We had our first network gathering in 2023 in New Orleans. It was when all of our birth center leaders came together in person for the first time, and it was magnificent. We had time to connect with each other in relationship, time for peer learning, and there was so much I think that came out of that time together that I cannot underestimate the value of just being in relationship and how it has accelerated the opening of our birth centers. It's certainly done wonders for us at Birth Detroit. We also founded and lead National Birth Center Week. And we had our first Birth Center Week in 2023. And our goal with Birth Center Week really is to work on transforming the culture of birth in this country to a culture of birth that respects midwives as leaders in care and understands how essential birth centers are to health infrastructure for maternal health. We got our first congressional resolution for Birth Center Week last fall in 2024. This year, our new projects and initiatives include our beloved Economy Studio, which is developed to help our birth centers meet the non clinical demands of birth center planning, development, and sustainability. We'll also later this year be launching Beloved Birth 50 by 50, an invitation to an audacious goal for our ecosystem as a collective action effort. This is what our network looks like today. So that first call and our first map had 14 birth centers on it, 14, including established and developing. Today's map, after 5 years, has 58 network birth centers. 20 of them are established and open and providing birth care or birth on site. The other 38 are developing. Some of those developing are currently running easy access or perinatal clinics and offering home birth. Our centers exist in 26 states and in Puerto Rico. When we started in 2020, birth centers led by folks of color made up 5% of the total number of birth centers across the country. Today, we make up 7%. And we're proud of that small shift and hoping to shift exponentially as we go forward. I share with you some leadership lessons I learned as I transitioned to really helping you understand our approach and how these briefings even came to be. The first thing is I learned and stand on that change happens in proportion to our courage and tenacity, right? It is so essential that we have folks like myself who decide to risk whatever's to be risked to stand on what is right and what is needed. One of our mantras at Birth Detroit is we are not asking permission to save our own lives. And for me, that means we're not asking permission to do what our communities need. I will humbly tell you that I feel like my courage comes from beyond me. And I know that it's in so many of you who are here today. And we gotta bring it together. The first act of courage is honoring our vision and holding to it even when others don't see. There were so many no's when we were starting Birth Detroit. We're starting Beloved Birth 50 by 50, and we got a lot of skeptics, but I'm not skeptical at all because I see it very clearly and I stand on that. And then finally, abundance lies in the flow of resources and trusted relationships, right? Abundance lies in the flow of resources and trusted relationships. One of the things that a mentor of mine for a long time told me right out of grad school was that relationships are primary and all else is derivative. I don't think I really understood it until the last 5 years, to be honest. And also, Alyssa Wright, who you met right at the top of the call, who helped lead our capital campaign at Birth Detroit, told me when we started together, and this was my first capital campaign, that we're not chasing money, we're chasing values, right? That we want to be in relationship with folks who have values that are similar to ours. And that part should make, ideally, fundraising for our needs easier. And so, with that at BCE, we take what we call a beloved economy approach to healthcare design, investment, and to our fundraising. So, we recognize that birth centers led by Black, Indigenous, and people of color are key to growing and sustaining community birth infrastructure. We seek to bring communities of collaborators together in the abundant flow of well informed, trust based relationships and resources. We see even this call, these briefings, as part and parcel of a strategic national local fundraising partnership to help birth center leaders overcome the capital barriers to providing midwifery care in our communities, to help us to finance optimal birth care today, and also to grow lasting infrastructure for generations to come. When we began these briefings in spring 2024, these are the goals we began with. We wanted to educate funders on the role of community birth centers as safe places for reproductive health and birth care. I don't think I need to do the definitions for most on this call, but we know that midwives are healthcare professionals that specialize in the reproductive life cycle. We know that birth centers are freestanding home-like places where midwives provide prenatal, postpartum, and birth care. My midwife colleague says midwives provide care period to period, so not just for birth. And we defined community birth centers as birth centers where safe, culturally reverent midwifery care is provided to all. We want folks to understand that birth centers are a critical evidence-based health strategy to improve maternal health and to address the maternal health crisis. The World Health Organization recommends midwives as the #1 way to prevent maternal mortality. The World Economic Forum recommends increased investment in midwifery around the world. Midwifery and birth centers are crucial parts of a vibrant healthcare system. Vital infrastructure for midwifery education, training, and practice. Birth centers are the only healthcare facilities designed to center the midwifery model of care. That is why birth centers. Birth centers are community institutions, healing generations, right? Because my grandparents and many of your grandparents were all born with midwives. Midwifery isn't new, it was taken away from us, and we are bringing it back. And we are healing our communities by bringing it back. And if we do it right, if we invest in ways that truly empower our communities, we will be growing beloved economy in the process. And so our work at BCE and the way we center birth centers is that our birth centers are emerging investment models at the intersection of reproductive justice and economic justice. We sought to and continue to seek to inspire folks like you and support folks like you to make informed strategic investments to support sustainable community birth infrastructure, development, and optimal maternal health. We have built ourselves as a relationship and values-based network truly from relationship building at the inception. So all of those dots on that map, our team has had one-on-one calls with. We have an in-depth survey annually to understand their needs and their fundraising progress and needs. We know our birth centers, and we are a team of birth center leaders, of midwives, birth center owners, business folks, public health folks, cultural strategists who are close to this work. We are the people we raise money for. We are the people that we support. We can best help you channel your resources into our communities and into our ecosystem. We third seek to facilitate follow-up introductions, relationship building, and technical assistance as needed. One of the biggest questions that we have gotten across our briefings across the 3 cities is, how do I know if I should give resources to BCE or give resources to an individual birth center? If you know exactly what birth center you want to invest in, give resources to that birth center. If you have any question, give resources to BCE, because what we have done is collect and understand our needs and priorities as a collective. And we have, number one, sought to pull down a level of resources that none of us could access on our own, and to channel those resources according to those priorities. And we can do that, broadly speaking. We could do that regionally. If your foundation has an interest in the South or the West or the Northeast, we can do that by community. If there's an interest specifically in Indigenous midwifery or Black midwifery, we could do that by state. We could do that by structure. We know how to channel the resources. Why reinvent the wheel? We have made some progress. So when we started BCE in 2020, our commitment to our community is $100 million over the next 10 years. What we began with is this $10 million goal in spring 2024. We are at 8.5 million, thanks to many of you who are on this call. We are so grateful. And these funds have fueled our network since that time and continue to, as some of these funds are multi-year commitments that haven't come into our hands quite yet. And we are looking to fill that $1.5 million gap. At this time, I'm going to hand over to my lovely colleague, Kimberly Durden, who, has been just as supportive of me in this work as I hope we have been to her, and who I credit with a lot of the success of our work at Birth Detroit. And with the building of a more robust network than any of us could have done on our own. So, Kimberly?
Thank you so much, Leslie, for that lovely introduction. I feel so excited to be here to represent BCE, to also represent my own birth center that I share with Allegra Hill Birth Centers. And I guess I just want to double check how much time do I have after the video, Les?
Excuse me, about 5 minutes.
Okay, great. I'm going to go ahead and play this video and then we'll talk.
Okay.
Tech support. Do I need to share my sound? I'm gonna
I got it. Sorry.
Okay, thank you.
Thank
Thank you.
Okay,
Thank you.
here we go.
A recent study analyzing maternal mortality rates shows pregnancy-related deaths surged in the U.S. by nearly 30% during a 5-year period ending in 2022. In tonight's In Depth, CBS's Elise Preston reports recent federal research funding cuts could hamper reversing this often preventable crisis.
The sound of sweet coos echo in this postpartum checkup class at Los Angeles Birthing Center, Kindred Space LA. Amina Falah soaks in every moment with her 2-month-old baby girl, Zaria.
I feel very blessed to have had this experience. Like the first thing I did when my daughter came out here was I thanked God.
A healthy birth after undergoing what Falah described as a traumatic delivery with her first child nearly 4 years ago. She was diagnosed with preeclampsia, a life-threatening complication, and underwent a C-section 9 weeks early.
By the time they did catch it, it was too late, and I went straight to the hospital.
What's going through your mind when they say your blood pressure is too high? We need to admit you.
We were definitely scared. It's a major abdominal surgery that I did not mentally prepare myself for, that I didn't do research for.
Research shows Black women disproportionately undergo C-sections, increasing the risk of complications like internal bleeding, blood clots, and infection that are also often diagnosed late or sometimes ignored altogether.
None of the nurses looked like me, but at the end of the day, regardless of what I looked like, I just wanted to be heard. Birthing is hard, but the least you want to worry about is dying when you're giving birth.
The U.S. has the worst maternal mortality rate of developed countries, and new numbers show Black women are 3.5 times more likely to die than white women. from childbirth and other pregnancy-related causes.
The racial gap widened. It went down for other folks, but went up for Black women. It's unacceptable.
And preventable.
Allegra Hill and Kimberly Durden opened this birthing center in 2020, where mothers, mostly of color, with low health risks have access to care.
Because of other things like structural racism and just like the level of like stress we carry as Black people in America, we're kind of like the cracks are bigger.
Our community doesn't have time to wait, so that if folks can get to us, we can take care of them and we don't have to wait until the system gets fixed.
Just this month, federal cuts at the CDC impacted research and programs dealing with maternal mortality. Despite the challenges,
My hope is that this work that we're doing lives beyond our lifetimes.
the midwives are determined to continue their work, combating a health crisis with help and hope. Elise Preston, CBS News, Los Angeles.
So I'm sure everyone here is, of course, aware of the statistics that we're constantly hearing about and having to deal with in this country around maternal mortality and infant mortality and not just mortality, but morbidity, which also we maybe don't talk about that enough. And it has been, well, first of all, I want to say I'm so excited to be here. I'm so excited. My heart is so open and so grateful and thankful for everyone who's taken time to join this call today. I also want to say thank you to Jess for that beautiful opening, and thank you to Leslie for her vision, for the vision that she and her colleagues created in 2020 out of a need that was quite great. And I feel like every time I look at the history and we share the history of BCE's trajectory, um, I am humbled, I am proud, I am excited, and I see where my own birth center follows pretty much that same trajectory. I keep forgetting to mention to my BCE staff that Rewire News article, Rewire also did an article on Kindred Space's dream of opening a birth center right around the same time they interviewed Leslie. So we'll have to include that and some stuff to show you all how our journeys have mirrored one another. And one of the ways our dream was able to fully come into fruition during the COVID pandemic, because we opened in October 2020, was because of entities like BCE, which were also growing. So again, thank you to folks who have funded not only Kindred Space LA, but funded BCE's vision, because it has helped us to keep our doors open to this day, and as well as other birth centers that are developing and established around this country. And, you know, it's been such a wonderful addition to my busy life to add working with BCE in the capacity of the Midwifery Network Engagement Director. I started in February of 2024, and wow, I mean, to be able to actually talk to folks that are developing their birth centers or have a dream of a birth center, or folks that have already been running birth centers for some time, has been eye-opening. It has been solidifying. It has just felt wonderful to connect with other birth center owners, BIPOC birth center owners around this country and Puerto Rico. And when I look at that little dot on the map for Puerto Rico, I know exactly where that is because I visited Vanessa's wonderful birth center in Puerto Rico. And as I visited many others, and to the main thing that I see, that I hear, is that we're all struggling, obviously, with the same challenges. So, what I hear when I talk to folks in the field is that, we're dealing with labor and delivery unit closures. Everyone knows that. We keep hearing about maternal care deserts, and that is real. I mean, I think 40 hospitals just in California, Southern California, closed in the last several years that were taking maternity services, some here even in my community. There are increased referrals to birth centers, and this is what we saw happen during the COVID pandemic. And this, I think about the COVID pandemic and how it catalyzed folks and got folks into action. So many organizations, so many centers were birthed out of the COVID pandemic because people were coming to us, calling us and saying, I need help, I need care, and I don't want to birth in the hospital. And so we really saw our growth, and I see growth across the network. And it's just amazing how much COVID really pushed our problems that were already there, the challenges that were already there, just made them completely untenable. And out of that grew an opportunity for us to grow these birth centers with all our might and all our will. We had to take care of our communities. Unfortunately, we see this time that, I guess in the lifespan of every foundation, there are going to be closures. In the lifespan of folks that provide funding, there's going to be changes, there's going to be pivots. And so as we've seen that happen in the landscape, this is really affecting our birth centers today. Our threats to Medicaid are huge right now. The problem is we were spending so much energy trying to fix Medicaid in these last 10, 15 years. And now we don't even know if we're going to have Medicaid in the same way. And it's become clear that there are going to be some changes and we are going to have to figure out how to roll with that. But at the end of the day, I do see this as opportunity. Every single thing on this list I see as opportunity. We need more midwives. Our folks that are opening birth centers need more midwives, need staff. And we are growing midwives as fast as we can. But this is a challenge within the field. And even if there are midwives available, we also have to be able to pay their salaries. And so we have more families that are seeking, out of hospital care for all the reasons, but what seems like at this moment, fewer resources. But at the same time, I have to say that all I can feel in this moment is that just as COVID had us really trying to figure out how we were going to take care of our communities in the face of some things that we had never experienced before, it became this catalyzing opportunity. This challenge turned into opportunity. And I feel that this moment in time, we have the same opportunity that's being created for us as we watch these systems crumble. We were like the canary in the coal mine. We already knew these systems were crumbling, and we've already been working on solutions and how we can continue to take care of our families in this country in the face of less funding, no insurance coverage, etc. So I am sure that in working together with folks like y'all, that we will find ways to create opportunities out of this, what looks like a very dire situation. So it's interesting for me to be excited in what looks like something very, very scary. But I recognize that we've been here before, and that we can come out of this stronger, more grounded, more prepared, and less dependent upon systems that weren't truly meant or built to support us.
Yes. Thank you, Kimberly. So Kimberly has led us here where we assert that now is the time, that in the same way that pandemic was portal for us to accelerate our efforts to meet the needs of our communities as they grow, now is a similar time. One of the movement leaders and writers I adore and got to spend some time with last summer in Ireland was Adrienne Marie Brown. And after the election results, she had a blog post, and in that blog post, she asserts that it is our turn. It is our turn to carry the world. And she says that we must decide who it is we will care for. The idea that because things are hard, we would throw up our hands and say there's nothing we could do, the problem's too big, we can't replace Medicaid, we can't do this, we can't do that. We don't have the luxury of throwing up our hands. Now is the time where we dig in. Because as she writes, we are each other's safety right now. And every day we should decide who we will protect, ourselves, our own, and who else. And so I invite you to consider that as you're caring for yourself and your own families at this time, to use your resources, your power, your circle of influence to protect birth, to protect birthing families, and to protect birth centers, because protecting birth centers means protecting midwives and protecting birthing families in this time. And we truly believe that if we center safety in birth care design, policy, and investment, then midwifery care is the natural next step. Healthcare is literally one of the maternal healthcare, is literally one of the only areas of healthcare where we allow professionals and policymakers and financiers to ignore a whole body of evidence that tells us that midwifery care is best for normal physiological birth. Yet, we just continue the way we have been, even though it's not working and even though all the data and evidence are there. Those of us who have the courage to say, no, this is not right. No, this is not what I want for my community. No, I will not continue to invest in care that is harming my community. We have to stand up. Midwifery care in community birth centers should be a widespread strategy to improve maternal infant health and to address the inequities we say we care about. And if we all can center ourselves in that, if we can come together in relationship on that, then there will be abundant resources to grow and sustain community birth infrastructure, which is at a lower overall cost to health systems, families, payers, and our communities. And not only could we keep families safe today, but we can courageously imagine, invest in, and create safe, gentle, loving, abundant, and liberatory futures for all families with our investments in birth centers, in midwives, and birthing families today. So we invite you to invest with all your might in this work. We invite you to bring your resources to bear to help us close this $1.5 million gap and to help us keep our community safe now and into the future. And before we do our Q&A, we will end on our love letter to the future. So you'll see a lot of our Network Birth Center leaders in here with a love letter to the future that I hope inspires you. Thank you for being here and thank you for listening.
Dearest beloved community, as co-founder and CEO of Birth Center Equity, I am so grateful to work in service to you in this lifetime. At Birth Center Equity, we seek to live with purpose, to grow community birth infrastructure for generations. At our hearts is our network of 57 birth centers led by Black, Indigenous, and people of color.
We're bringing forth the beloved birth culture of the future. A birth culture that is family-centered, midwife-led, community-held, and honors the inherent value of all people.
I pray this horizon is in view and becoming ever clearer.
I pray that those who move resources, write policies, and shape our workforce rise to the occasion, aware and inspired.
May hearts, minds, and money be moved.
I pray that the history books will tell how we put birth back in the hands of midwives and how we honor birth at the heart of the beloved community.
Rezo que toda la humanidad sea más sano con esto.
I pray that our Black, Brown, and Indigenous children and all children will begin life filled with love and infinite possibility.
May birth centers catalyze the growth of healthy families.
Revitalize neighborhoods, breathe power into our communities, and midwife our dreams into being. And with that, I will pass back to Jess and Alyssa.
Thank you so much, Kimberly and Leslie, for the presentation. And now we do have about 10 to 15 minutes to answer questions. We would love for this to turn into a conversation with you all. Now that you've heard our presentation, go ahead and I'll go ahead and read out questions from the chat. I'm sorry, from the Q&A. And if there's any clarifiers or information that people want to add, they can always put that into the chat. So our first question, I think, is for you, Leslie, and that is, what regions need the most support right now in the USA?
I think that's a hard question because all regions have need. We have seen, thankfully, a lot of funders particularly interested in supporting our birth centers in the South and midwives in the South. There's need there. We also have very few Indigenous-led birth centers in our network, and there is a huge support need there. And so I would say all of our birth centers have need, but if you wanted to center in now on a regional need, I would take a look at the South. If you wanted to center in now on, a need by culture or community, I would uplift our Indigenous-led birth centers. And Kimberly, what would you say? I know you speak to folks every day.
Well, to your point, I mean, everyone has a need. Again, we're supporting Black, Indigenous, folks of color birth centers. So the most marginalized communities all around this country are in deep need, and for different reasons. When we talk to our indigenous birth centers, in particular, the folks that are trying to pull it together on reservations where they have less access to many of the most basic needs, there's those issues. And then when you're talking about urban settings, we have a different variety of issues. So, when we talk about states that are still working out the legality of even birthing out of hospital, I mean, we don't even get into that, as much, because we're trying to help the folks that can do community birth, but we also have needs just helping people on the legislative end to help get laws to be more favorable to community midwifery. So it is a wide variety of needs. And I think we do have another question.
Yeah, we have a couple of questions. So one is Melissa saying, I love the parallels with COVID and the current moment. What are some emerging needs that are surfacing for birth centers already?
Yeah, if I can speak to that, because I actually did write some notes on that, Melissa, and thank you for that great question. And also great to see you briefly at the IBC conference. I think what would be wonderful for birth center equity to be able to do is provide those rapid response funds, or I actually would break it up into 3 sections: rapid response, So for immediate needs, and it's such, I mean, I have to tell y'all, and I'll be very transparent. Kindred Space LA has been open for 5 years. We've just opened our new location in Lancaster, but I did payroll this morning and it was eked out. And, you know, that's the real of this work. That we have successes and that we're making headway and we're making gains, but I'm eking it out and crossing my fingers and doing all the things. And that is what people are facing across the ecosystem. They are open, but they're scraping by. So immediate rapid response fund needs are huge. But then we also in BCE are wanting to help people in the planning. So we're talking about the short-term stabilization funding. So funding that can help people for the next 3 months or the next 6 months to help them get stabilized enough so that they can build a better structure of their birth center. And then long-term stabilizing needs is there as well. So these are the emerging needs. In particular, when we're dealing with the challenges of immigration challenges for birth centers that are on the border, they have to be able to keep their doors open to respond to the influx of folks that are needing their care, just as one example. So I would break it down into those 3 sections: immediate, short-term, and long-term funding.
Thank you for that, Kimberly. So this one could be a long answer, but I think we also have a containable answer here, which is I love what Ebony said. May hearts, minds, and money be moved. How do we remove the disincentives? Maternity care has been a loss leader for hospital and health systems. It is chronically under-resourced. So how do we create a sustainable system?
I would say the first thing we have to do is prioritize families. I think what we've done in healthcare in this country is we have centered certain professionals and we have centered certain systems. We've centered physicians, we've centered hospitals, and we've centered healthcare systems that don't serve families well. One of the things that I've seen in my work and that I just gives me the most frustration is when I hear professionals in power say, you know what, my department won't let me do that. My health department, we can't do that. Oh, you know what? My hospital won't do that. You know why? Because nobody's making them. You know why? Because nobody is pushing and pushing for change or creating the change outside. And so I do think there's another colleague in the field that says, like, there's a place for everyone. Right? There are those of us who will work in the systems to move them, even if it's baby steps at a time. There are those of us who will hospice the old systems, even if it's baby steps at a time. There are those of us who will put out the fires there. There are those of us who will deal with that pushback. And then there are those of us, like us in BCE, who are going to build what our communities need, no matter what. And so I would suggest for those of you who are interested to invest here because we are building the maternal health care system of the future. And one of the things that we assert with Beloved Birth 50 by 50 is that we can, like we created the culture of birth we have today. We can create the one we want in the future. And that one is midwife led with physician collaboration. That one centers families. That one is community held, not hospital anchored. And that one honors the inherent value in all people and the expertise of all credentials. And we can build that here.
I love that answer or that response, Leslie, and I love your question, Suzanne. And you know, I often think as I travel around and I work with organizations, how much money we have spent to heal harm, to try and heal harm that has already been done. And what would it look like if we took the money and used it to prevent the harm? We can redistribute and redirect resources to preventing harm and to even healing past harm. With the video that was showed that was from CBS News that we were blessed to be in. The client had past harm for a past birth experience. And not only was her next birth experience, because we existed, able to prevent or to heal, to prevent harm, more harm, but it also healed past harm that she experienced. And therefore, we often forget that when we are talking about human beings here. And so when we prevent harm and we heal past harm, we build healthier families for the long run, which ultimately is going to be less weight on the overall system. But I think that we are learning, and we are learning, to Leslie's point, we are building this new system as we speak in the work that we do every day at BCE, with the feedback and with the voices of the folks who are on the front lines doing the work. And so this is what also keeps me very excited. We're building something anew.
Well, on that note, I think we'll, do we have one last question here? Yeah, let's try to do this one in just a minute or so. Let's see, I noticed I'm joined today by partners working in state government. As an AMCHP supports our members in aligning their resources behind community solutions, do you have any hopes, fears, or calls to action for state health agency leaders who seek to invest state or federal funds in actions for this beautiful vision? Thank you for that, Andrea.
Yes, we do. In fact, in our beloved Economy Studio, which is a project of BCE, we are in talks, and we'll soon have contracts with a couple municipalities across the country who wish to invest in community birth centers in their county or in their state. There are also regional planning efforts for birth center integration at local levels and state levels going on across the country. And so for those who have interest in that, we have a team that's poised to support you and or connect you with peers across the country who are doing something similar.
I think that is a beautiful place to end our Q&A. And I'll move to you, Alyssa.
Thank you so much, Jess. I'm I'm feeling a little bit speechless just because I feel like this was such important energy to have right now. I feel like, Leslie, when you were sharing, I was like, time to be unapologetic, like just unapologetic and fierce coming out of the gate, and have it, you know, in our DNA moment to moment to talk about this work and to connect people to either the birth center in their community or to the broader network that is BCE. And so I want to just thank everyone and hope that that unapologetic, fearless energy takes you into the rest of your day. As you move, out of this conversation, and think about the steps that you can take towards bringing more birth equity into your community, no matter what we all face together. So we launched, as Jess shared earlier, this $10 million Grow Birth Centers campaign. Deep gratitude to several of you on the call who have been a part of bringing that 8.5 million into this process and project. If you feel moved to act to help us close the gap in the coming months, I really hope that you reach out. We are hoping in the next few weeks to have conversations with many of you to bring in that last 1.5 million. I also want to name all the other opportunities that Leslie and Kimberly mentioned, as well as Jess, to get more involved in the work with whatever resources you have to bring to it, your social capital, your heart capital, your intellectual capital. Please be in touch with us and be in conversation during these times. Things change week to week and moment to moment, and I don't want us to miss out on resourcing this work with all we've got. So please do reach out as we close this $1.5 million gap. We are looking and having conversations with donor advised fund holders, with grant makers, with families, with individuals, with everyone who wants to be a part of this momentum right now. We have monthly donors who have stepped into it. I'm really proud that we've had everything from $5 to 4 million come in a range of gifts and giving to our work. So we have quite the spectrum of folks being involved, but now's the time to really invest and put those resources behind us. I will also name that we do have our biannual convening this fall in Santa Fe. So please do, if you want to reach out, please do contact us about supporting and sponsoring those 59 network members that are coming together for our gathering this fall. It's going to be a really momentous year for them to be in community. And I'd love you to support our network with a gift towards that as well. So thanks for showing up and believing in this vision and walking with us. And do reach out. We are invest@birthcenterequity.org, or you can contact Leslie, Kimberly, Jess, or myself via our personal emails. And with that, I'll hand it off to you, Leslie, to close the circle today for everyone.
I know that we have 1 minute, and so in that 1 minute, I would just express my gratitude to you. I would encourage you to consider, who you will care for and prioritize in this moment. And I hope you join us in prioritizing birthing families. And as you exit and leave us, if you want to drop a note in the chat of how you feel as you leave, we would appreciate it. And I feel grateful. Thank you very much and have a lovely day.